ER-positive breast cancer, prognosis, life expectancy, and more. Estrogen receptor-positive, ER-positive breast cancer is the most common type of breast cancer diagnosed today. According to the American Cancer Society, about 2 out of every 3 cases of breast cancer are hormone receptor-positive. Most of these cases are ER-positive, meaning that there are estrogen receptors on the surface of the cell that bind to estrogen. This cancer typically responds to hormone therapy. Your prognosis will depend on what stage the cancer is in when you're first diagnosed and how well your body responds to treatment. ER-positive breast cancers can have a favorable outlook when they're treated early. Some of the decline in breast cancer mortality rates can be credited to the effectiveness of hormone therapy drugs prescribed to women with ER-positive breast cancer. Newer treatment options for ER-negative tumors are also improving prognosis and life expectancy. How is ER-positive cancer diagnosed? If your doctor suspects breast cancer, you will likely have a biopsy to test for cancerous cells. If there is cancer, your doctor will also test the cells for characteristics that include what receptors, if any, are present on the surface of the cancer cells. The outcome of this testing is important when making treatment decisions. What treatment options are available is highly dependent on the test results. If you have ER-positive breast cancer, your cancer cells grow in the presence of the hormone estrogen. Estrogen occurs naturally in the body. Drugs that interfere with estrogen's ability to promote cancer cell growth are used to treat ER-positive breast cancers. What is a hormone receptor? In breast cancer, hormone receptors are the proteins located in and around breast cells. These receptors signal cells, both healthy and cancerous, to grow. In the case of breast cancer, the hormone receptors tell the cancer cells to grow uncontrollably, and a tumor results. Hormone receptors can interact with estrogen or progesterone. Estrogen receptors are the most common. This is why ER-positive is the most common form of breast cancer. Some people are diagnosed with progesterone receptor-positive, PR-positive, breast cancer. The key difference is whether cancerous cells are getting growth signals from estrogen or progesterone. Testing for hormone receptors is important in treating breast cancer. In some cases, there are no hormone receptors present, so hormone therapy isn't a good treatment option. This is called hormone receptor-negative breast cancer. About 2 out of 3 people with breast cancer have some form of hormone receptors present. This makes them candidates for hormone therapy. What is the life expectancy for each cancer stage? Your outlook depends on the stage of your cancer when it's discovered. Cancer is staged by number, starting with 0 and going to 4. Stage 0 is the very beginning and stage 4 is the last stage, also called the metastatic stage because it's when cancer has spread to other areas in the body. Each number reflects different characteristics of your breast cancer. These include the size of the tumor and whether cancer has moved into lymph nodes or distant organs, like the lungs, bones, or brain. The cancer subtype doesn't play a role in staging, only in treatment decisions. Survival statistics of women with the major subtypes of breast cancer, such as ER-positive, HER2 positive, and triple-negative, are grouped together. With treatment, most women with very early-stage breast cancers of any subtype can expect a normal lifespan. Survival rates are based on how many people are still alive years after they were first diagnosed. 5-year and 10-year survival are commonly reported. According to the American Cancer Society, 5-year survival rates are stage 0 to 100%, stage 1 to 100%, stage 2 to 93%, stage 3 to 72%. Stage 4, the metastatic stage, 22%. One thing to note is that these statistics also included women with the more aggressive HER2 positive and triple-negative cancers. And it takes 5 years to get to a 5-year statistical survival rate, so newer therapies are not included in these numbers. It's likely that a woman with ER-positive breast cancer diagnosed today may have a higher chance of survival. How is ER-positive breast cancer treated? There are a few different treatment methods for ER-positive breast cancer. Your treatment plan will likely depend on what stage the cancer is in and whether you're premenopausal or postmenopausal. Hormone therapy. All women who have ER-positive breast cancer will be recommended a type of hormone therapy. This type of therapy aims to prevent estrogen from activating cancer cell growth. In the past, Premenopausal women were treated with a selective estrogen receptor modulator, like tamoxifen. Postmenopausal women were treated with an aromatase inhibitor like Arimidex. Both treatments starve the cancer cells of estrogen so they can't grow. Current guidelines from the American Society of Clinical Oncology recommend stopping the ovarian production of estrogen in addition to hormone therapy for women with high-risk ER-positive cancer. The risk factor is determined by the stage of cancer and how likely it is to return after treatment. A woman enters menopause when her ovaries stop producing estrogen. Then they are treated with aromatase inhibitors like women who enter menopause naturally. Hormone therapy may still be recommended for stage 4 ER-positive breast cancer. Although at this point the cancer is incurable, a woman with stage 4 ER-positive breast cancer may respond well to hormone therapies that can extend life for many years. Surgery. Most women with early-stage breast cancer will have surgery before starting hormone therapy. Surgical options will vary depending on the size of the breast, your personal preference, and the size of the cancer. You can either have part or all of the breast tissue removed. A lumpectomy removes breast tissue but not the entire breast. A mastectomy removes the entire breast. Most women will likely also have one or more lymph nodes removed from under the arm. Depending on what type of surgery you have, you may also need radiation, which uses high-energy rays to kill leftover breast cancer cells. Chemotherapy. An Oncotype DX test can show whether chemotherapy will be beneficial and reduce your risk of relapse. The test examines 21 genes in cancerous tumors to identify the potential relapse rate. If you have a low recurrence score, you will likely not need chemotherapy. If you have a high recurrence score, you will likely need chemotherapy, surgery, and hormone therapy. The Oncotype DX test, which may be paid for by Medicare and most insurance plans, is recommended for women who have HER2 negative breast cancer, have early-stage ER-positive node-positive or node-negative breast cancer. Chemotherapy uses powerful drugs, delivered through the veins or taken as a pill, over the course of several weeks or months. They're designed to kill cancer cells. Outlook. ER-positive breast cancer has a high chance of being successfully treated, especially when it's discovered early. A diagnosis at a later stage will have a less positive outlook, but being diagnosed at a later stage is less common. There are still many treatment options for late-stage cancer. The outlook for women with ER-positive breast cancer is generally good, and there are effective treatments. The chances for a long life are excellent. Getting a cancer diagnosis and treatment can feel overwhelming, but it can help to get support from others who know what you're going through.